By mid-February 2020, the coronavirus pandemic had expanded to touch nearly every corner of the globe. WHO has declared the virus a global health emergency and rated COVID-19's global risk of spread and impact as very high, the most serious designation the organization has. The South African government initiated the lockdown strategy effective from 26 March 2020 to limit movement, thus the rate of infections. In May 2020, the government conceded to gradual reopening of the economy to allow for more work to be conducted. However, basic mandatory guidelines need to be followed to prevent further spread of the virus. Organizations, schools, and employers need to stay safe. Here are some useful tools.
The truth is that we cannot hide forever. Well, because we have an already weak economy to resuscitate. The South African Reserve Bank and IDC projected a 5% economy contraction, 6% GDP decline, leading to over 7 million job losses across industries. Hello, Sanbonani. My name is Covicle, and I will share with you the requirements for the workplace preparedness as outlined by our government to help you back to work at less risk of further spreading the disease, so we can save our jobs and support our economy.
Dealing with this virus requires collective effort, and it all begins with you and I. How do we ensure that we stay committed to reviving the economy while being responsible with our moves and interactions at the same time? We must remember that the virus does not move. We move, and therefore we unintentionally spread the infections as we move. As an individual, you are an employee, a student. This makes you a healthcare practitioner, a university graduate looking for a job, a teacher, a shopkeeper, and a taxi driver. Your reach in one single move may affect many people. We also come from homes where our siblings, our kids, and our helpers interact with us and their world outside our homes.
We're no longer at the stage of things with this virus and this pandemic where the numbers are just that. Sadly, the anonymity has fallen away, and we're at the part of the journey where the numbers comprise of people we know, respect, and love. It's time for us to adopt a different strategy where we take into account that what is needed for us goes far beyond just what the laws imposed by the South African government dictate. What has been said by the WHO in terms of recommendations is no longer just a pie in the sky. It's personal now. Moletsane is my friend. It was his birthday this past weekend, and he had not seen his girlfriend for over 100 days because of lockdown regulations. But they missed each other, and they made plans to see each other in celebration of his birthday. He is not only loved by her though, he is also loved by his friends, and they came around to celebrate his special day too. Because they had all missed each other greatly, they hugged and held hands and did not always observe the rules of social distancing. They shared utensils when they ate from one platter, they shared plates, and they drank from the same glasses. They did not always sanitize their hands, and after the festivities, they all went home. This is how the story of the effects of the COVID pandemic unfolds.
All employers should implement and train employees as necessary to support the new communal duty of 1. Reducing the risk of further infections by actively encouraging sick employees to stay at home, conducting daily in-personal or virtual health checks, Identify where and how workers might be exposed to COVID-19 at work. 2. Classifying worker exposure to SARS-CoV-2. Those very high exposure risk jobs are those with high potential for exposure to known or suspected sources of COVID-19 during specific medical, post-mortem, or laboratory procedures. Those are health workers, laboratory personnel, morgue workers performing autopsies as an example. High exposure risk jobs are those with high potential for exposure to known or suspected sources of COVID-19. Healthcare support staff, medical transport worker, or mortuary workers. Medium exposure risk jobs include those that require frequent and/or close contact with, i.e. within 2 meters of people who may be infected with SARS-CoV-2 but who are not known or suspected COVID-19 patients. In areas where there is ongoing community transmission, for example, workers, learners in school, patients in consulting rooms, etc. Lower exposure risk jobs are those that do not require contact with people known to be or suspected of being infected with SARS-CoV-2, nor frequent close contact with, i.e. within 2 meters of, the general public. Workers in this category have minimal occupational contact with the public and other co-workers. 3. Implementing workplace controls. The legislation governing workplaces in relation to COVID-19 is the Occupational Health and Safety Act 85 of 1993, as amended, read with the Hazardous Biological Agents Regulations. Section 8(1) of the Occupational Health and Safety Act 85 of 1993, as amended, requires the employer to provide and maintain as far as reasonably practicable a working environment that is safe and without risks to the health of employees. Specifically, Section 8(2)(b) requires steps such as may be reasonably practicable to eliminate or mitigate any hazard or potential hazard before resorting to personal protective equipment. However, in the case of COVID-19, a combination of controls is required, although the main principle is to follow the hierarchy of controls. These are administrative controls, conduct in-person health checks with safety and respectfully, encourage sick workers to stay at home, minimize number of workers on one site at any given time, develop emergency communications plan to keep your employees updated, provide workers with up-to-date information and training on COVID-19. Engineering controls, installing high-efficient air filters, increasing ventilation rates in the work environment, installing physical barriers such as face shields, safe work practice and PPE. Create a work environment that promotes personal hygiene. Regular hand washing is a must. Display warning and reminder signs in kitchens and restrooms. Employers are obligated to provide their workers with personal protective equipment needed to keep them safe while performing their duties. The types of PPE required during a COVID-19 outbreak will be based on the risk of being infected with SARS-CoV-2 while working in jobs, tasks that may lead to exposure.